The problem of the uninsured and underinsured is not going away. In fact, it is getting worse. Today in the United States, more than 46 million Americans lack coverage. The lack of health care coverage affects people right here in Iowa, your friends, neighbors, business associates, co-workers, and relatives. In Iowa, approximately 275,000 people have no health insurance coverage. Thousands more have inadequate coverage, coverage that they pay too much for or get too little from. Inadequate coverage leads to medical debt, and this can create a series of problems that further affect individuals and their families. From not seeking medical treatment because of the debt they already have incurred, to potentially losing their home, these are serious issues that cannot be ignored any longer. Today, we want you to see the faces and hear the stories of those affected. These are real people that are uninsured or underinsured. They deserve to be heard, and we must address these situations.
My husband was diagnosed several years ago with diabetes, and we neither one of us had much health care. That he had none. He worked for a small construction company, and they had no benefits. My company offered some health care, but it was not affordable for us at that time. He suffered a heart attack and had to have surgery done, and the cost of the medical bills was over $33,000. We tried to pay the debts, but he, having the diabetes and the heart condition, his medications cost us $300 a month. So I couldn't really afford to pay for the medication and try and pay the bill off. Finally had to make the decision to file bankruptcy. Last November, my husband suffered a massive heart attack and passed away. And that has also affected me greatly, dealing with the loss of his company. And besides all that, having medical debts and burial costs. I had a small life insurance policy on him. It was $5,000. I still am carrying debts of around $20,000 that I'm unable to pay at this time. I'll get responses on the phone, or they'll look at you like, well, you know, you're, what do we want to say, a second-class citizen because you can't pay your debts. That's not true, but that's how you're made to feel sometimes.
I'm lost. It's very frustrating I've always been more of the giver for everyone. I'm a volunteer for the Red Cross, for the Iowa Donor Network, for the Kennedy Foundation, for our Chamber of Commerce. I've always given. My family's always given. And now it's making me feel very helpless in a situation that I never thought I would have to be in. I have had several, the Democratic parties, Republican parties, stop at my door, them not knowing my situation, and I started asking them about health care issues. And I have found that they all are giving me the information that I want to hear. And then I go into it further with what I personally need, and they all agree with what I've said, of course. I guess I'm wanting to see that whoever is elected to follow through with those plans, to follow through with a more affordable insurance. There's so many people out there that are hurting and not getting the treatment that they need to. I have had to stop my 401k plan for the fact that instead of worrying about my retirement, I have to pay attention to paying bills today because I want to take care of myself. I'm not asking for handouts. And so I'm just asking a fair shake from the government.
And about 3 weeks after the surgery, I ended up with staph infection, which put me back in the hospital. I was in the hospital for 3 weeks, and the bills just kept racking and racking and racking up. And while I was in the hospital with the staph infection, I found out that my insurance was cut off because they said I didn't pay a bill to keep it going. And I found out that they weren't going to pay anything on my hospital bills at all. And it got to be so expensive, and I didn't know what I was going to do. If you're willing to go out and take care of residents, people in the situation that are worse off than you, then you should have enough care to keep yourself healthy, to take care of the ones that can't. And there's nothing out there to help that. I mean, you get sick. There's a lot of times I went to work sick because I can't afford to go to the doctor to tell me I can't work. So I just go into work sick and hope that none of the people you take care of don't catch what you have. I think people look at me and think of me as lazy because they don't know my real story of what's going on. It's just like the fact that I've lost a lot of weight before I had all these medical problems, and then all of a sudden I put all the weight back on. People are looking at me, looking down at me. It's like, how could you lose all that weight and gain it right back? Well, you got to look at the circumstances, the stress, the disappointment. It all ties into what you're doing in your life. And they look down at me. I feel lost. Like I can't get anywhere in this world. I can't make it. That's the way I feel sometimes. I'm always one to look up at the situation and hope that there's hope out there.